Hi, I'm Carmen McIntyre, the Chief Medical Officer for Detroit-Wayne Mental Health Authority. I'm going to spend a few minutes today talking to you about community inclusion. Community inclusion is not a new concept. When Rosa Parks sat down on that bus back in 1955, she was actually standing up for inclusion. So what is community inclusion? Let's go back to Rosa Parks for a moment. In the past, segregation was the norm, which meant black people would have to ride a different bus from white people. Later, there was integration, which meant that Rosa could ride the same bus, but there were different rules for her. Inclusion means she would have all the same choices as anyone else in riding that bus. So let's walk through something similar for persons with behavioral health challenges. Segregation means being separated from the rest of society in disabled-only programs, such as sheltered workshops or group homes. Integration could mean living in the same apartment building as persons without disabilities, yet there are different rules. For example, you don't get to choose your own apartment or your own roommate. You can't decorate as you want. You don't choose the food you eat or when you eat, and you're not allowed to sign your own lease. Inclusion would mean we redesign the whole system so everyone has recreational, employment, and residential options that meet their needs. We wouldn't separate people based on disability. In the words of a consumer, people with disabilities can't succeed if confined to sheltered work programs designed solely for people with disabilities. So instead, community inclusion is about all of us, not just those from a specific group. It's about people having an ordinary life of activities and relationships with other citizens in ordinary physical and social settings. Community inclusion values diversity, and it builds communities. It means we all live a full life and learn to live together. Many of the people we serve choose a segregated or integrated setting, and we don't intend to take away those options when they're appropriate. Yet, many others would like the ability to obtain competitive employment, to live independently in the community they choose, and have fun with the people they choose. At the Detroit-Wayne Mental Health Authority, we want to make sure that the people we serve engage in genuine participation in the day-to-day life around them and have access to all of the choices available in our community. The federal government feels the same, as evidenced by the Centers for Medicaid and Medicare Services Home and Community-Based Final Rule for 2014. Therefore, community inclusion is one of the important focus areas for our strategic plan. We look to our stakeholders, the persons we serve, their families and supports, our providers, MCPNs, and the community at large to help us set our targeted goals and objectives to ensure that our system embraces community inclusion. We look forward to working with you to make this dream a reality.